Welcome. I'm Mark Davenport, and I'm the president of the British Association of Pediatric Surgeons. We've put together this presentational package on how to prepare abstracts suitable for presentations at most scientific meetings. It comes a little bit with a health warning in that these are not absolute requirements for our BAPS conference or congress, but simply ideas with the aim of trying to increase the likelihood of acceptance at most scientific meetings. So I'm going to take you through the general structure of an abstract. And then, if you are lucky enough to be accepted for a presentation, how you would probably construct a poster or indeed deliver an oral presentation. The style, of course, is entirely up to yourselves. So this is an abstract template. In fact, it was taken from the last year's BAPS meeting in London. As you can see, half of it's actually taken up with instructions, labelled as here as important notes. And it is important that you read these notes. As you can see, they are also full of imperatives: must, will, do's, do nots. Follow these to the letter. One of the chief concerns with a lot of abstract constructions is how long the abstract should be. It can range from 200 words up to a fairly generous 300 words, which is more than enough for most people. In ours, we simply use the phrase "it must fit into the box." And as you can see in this particular example, it does so perfectly. So even the most junior of submitters should be able to understand and read the. So let's now look on how to actually construct an abstract itself. The conventional scientific way of doing this is to separate the abstract into individual sections, and conventionally we open up with an introduction or an aim of study section. The idea of this is simply a way of presenting upfront your hypothesis behind the study itself. The next section conventionally is the method section, and key points within the method section is how you actually collected your data, whether the data itself is, as it so often is in surgical studies, is it retrospective? Did you simply do a case note study? This clearly has some weaknesses by comparison to the prospectively collected data set, or indeed a randomized controlled trial. Most scientific surgical studies involve some element of comparison, and these really should be analysed statistically, and therefore the actual statistical method needs to be put down here in this section, together with an appropriate level of a p-value. The real important part of any abstract is the results, and these should not be skimped over. It's important to get upfront numbers into this particular section. How many are you actually talking about should be almost the first sentence in the results section. Any kind of comparison should involve or assertion of superiority or inferiority, etc., should be supported with the actual raw data, together with a p-value or confidence interval as you prefer. And then finally, we should have a definite conclusion to the study, whether your hypothesis was proven or still remains unproven. But to reiterate, the single most important section is the results section. This is the part very often that those who have to judge an abstract will be drawn to first. This is really where you're presenting original observations of real things. So let's break down this particular abstract, trying to illustrate with the points that I've put forward. This was an abstract that was accepted, so it did manage to pass a particular level of inquisition. Let's start with the title. It's fairly short. It does give the two key features for the actual study itself, prematurity, and it's about biliary atresia. And I followed a fashion here by introducing a question. This is quite common in a lot of surgical meetings, but doesn't really translate if you're going to make this into an actual paper itself. One obvious thing to note is that you don't know where this paper is from or who actually wrote it. Virtually all scientific meetings, when requesting abstracts, make it very important that the abstract itself is anonymous. So it does not say prematurity and biliary atresia, the King's College Hospital experience, for instance. You may well guess because of the numbers, but nonetheless, you're not actually sure. So it is important to bear this in mind, particularly when you put the method section, that you don't introduce the actual name of your hospital or where the data is from. Okay, let's open with the aim of the study. Here, you do have to assume a level of knowledge by the person that's going to do your abstract marking. As you can see, I've not gone into what biliary atresia is, who it affects, how it presents even. We've just said the diagnosis of biliary atresia remains challenging and delay can lead to, etc. We have introduced the concept of prematurity, which is an unusual feature for biliary atresia, but that's the subject of the actual hypothesis itself. The method section, it is a prospectively maintained database which has got some important implications. We've then gone on to define what the definitions of prematurity that we're using. This also has an element of outcome analysis. So we've defined what kind of outcome that we're looking for. And as it is going to contain a comparison, we've stated that we're using non-parametric univariate analysis as part of the scientific statistical method. The last sentence in the method section I do like putting in, and this is how we're going to describe the data. So we're quoting it as a median and in brackets a range. One advantage of this is that you don't have to then, in the results section, simply repeat the median of range of each and every observation that you make. So it saves a little bit of space. This is the results section. It is the biggest section, and that's important. We've started off describing exactly how many were in the series itself, and we've tried to describe what period they're from and some key characteristics. It then goes on to some comparisons. So there are comparisons of outcome. And when we do use the comparisons itself, we're also quoting the raw data together with the result of the statistical analysis. And then finally, in the conclusions section, I like bulleting simply to draw the eye onto your conclusions. Was there anything definite in your study itself? Was there anything that's importantly negative that you didn't find that you perhaps expected to find? Does it support or reject the hypothesis that you originally? So let's assume that you successfully submitted your abstract. It's important to get a reply from the organising committee that you have submitted that abstract and that a number has been assigned to your abstract, and that it's within the deadline of the particular meeting itself. A few short weeks will pass and a decision will be made and conveyed to your inbox, and let's assume that you've been accepted for poster presentation. So I'm going to go through a few points about poster presentation. The traditional way, of course, is to actually physically construct a paper version of your poster for display, actual display in an exhibition or hall. But there is an electronic option in some meetings where you simply turn up with the computer file and it's displayed electronically. One of the key requirements of a paper presentation, however, is to get the size of the poster correct. This will be almost certainly within any kind of acceptance letter, and it is very advisable to stick within the size constraints. Sometimes you're asked to actually orally present the contents of your poster verbally, and this may be in the form of a 1 to 2 minute presentation, as it were, on the floor as part of a poster session, whereby a chairman will be going around each and every poster with groups of people, and they will invite you to tell them exactly what is in your poster, and you'll be there to answer questions. Sometimes this will be part of a more formal presentation, often involving a single prepared slide. So it's a sort of mini oral presentation itself. Again, it's important to read the acceptance letter for this is an actual poster that was accepted last year. Let's work through the various components of a fairly standard poster presentation. The title. The title isn't too long, and it encapsulates exactly what this poster is all about, which is a CCAM, complicated by malignant transformation. It does claim to be the first, which is always a fairly contentious issue, but if that's all you want of a poster, that would do. I do like to have some kind of hospital or institutional logo up front in posters. It does give a sense of belonging to an organisation. And if you've got a number of different posters accepted at the same meeting, try and follow the same template. In this particular poster, we've adopted a 2-column format, and we're running from the upper left, the top left, going downwards, and then ending up at the bottom of the poster. So the idea is that all the clinical information is on the left-hand side, with the supporting, if you like, radiology and histology on the right-hand side. If there are any figures, make sure the figures are clear, that they are in black and white, or more preferably in colour. It's more attractive to the eye. If they do show relevant features that you want to illustrate, make sure that you put arrows or circles around the points that you think are important. This is particularly valuable, obviously, when you're interpreting histology slides, because none of us really want to be histologists, really. And end up with a conclusion. I've chosen a differently coloured box for this particular thing. Again, if you're just motoring through a poster exhibition, your eyes may well start at the title and then a couple of seconds later just see what they've concluded, and then that's all that that person will take from your poster presentation. So make the conclusions obvious. But it's your good fortune you've been accepted for oral presentation. You are going to be invited to step up to the rostrum and deliver the study that you've been slaving over for the past few months. The rostrum, incidentally, was a place in the Forum in Rome, in classical Rome, where senators delivered their orations to the crowd. Speaking in public can be a formidable undertaking, nerve-wracking, sweat-inducing, and even world leaders, President Xi of China and President Putin addressing the Russian parliament, know that they have to get this part right. Even if Theresa May doesn't quite understand it, the relationship between you and the microphone is important. So let's see if we can perhaps give you some guide to try and get this part of the process correct, or really trying to avoid mistakes. The first suggestion I would have is go and upload your presentation early. Make sure you give the actual file to the technician and look at it in the slide preview room. Go through it, sit down, go through it. Make sure what you think you're presenting is actually going to be recognized by the host system. Some people will use an out-of-date version of PowerPoint in which doesn't recognize the animations that you're trying to use, doesn't recognize the fonts that you're trying to use. This gives you an opportunity to change it at the last moment. Before the session starts, introduce yourself to the chairman or woman. Make sure they've got your name correctly pronounced. Go up to the rostrum, stand in front of it, look at where you're supposed to see what the audience behind you can see, where your monitor is. Look at where the microphone is positioned. If you're too tall or too short, change the position of the microphone. Try and avoid excessive head movements. Keep your delivery even. Keep your delivery balanced. It's always impressive when people walk up to the microphone and then begin speaking and can speak for 15 minutes, 20 minutes or so without any kind of notes, without any kind of mistake. Typically, they've done it, however, 100 times before, know each and every word that's coming out of their mouths. If you're junior, if you're inexperienced, if you're particularly nervous, have what you're going to say in front of you, either in the form of notes, keynotes, the first sentence of every slide, or particularly if English is not your first language, have the entire script in front of you. Try and get this part right. People will make allowances for how you deliver it, particularly if you're from overseas. Speak to the audience. Speak to the front row, speak to the back row. Look at your audience. In terms of the software, 99.9% of our scientific deliveries will be in PowerPoint, but there are other options. Some people will use Prezi, for instance, which looks very impressive if it goes right, but if it goes wrong, can be difficult to understand. As you can see, I like using animations so that what's in front of the audience is matching what you're actually trying to say to them. Videos can be very impressive, can be very important to a presentation, but equally well can often go wrong. And one of the problems with videos typically is that the person that's designed the presentation has done so using a Mac and using QuickTime for the actual video itself. And that may not be recognized by the host system itself. Try and get this part right. The way to demonstrate that it works is before your presentation in the slide preview room. One of the key things for all successful oral presentations is getting the timing right. You will know from your acceptance letter how much time you have got to deliver your presentation. 10 minutes was the standard. But this doesn't actually mean 10 minutes of your presentations. It's broken down. So it's 7 or 8 minutes to present and 2 or 3 minutes to answer questions from the floor. In the acceptance letter, it will be precise. Stick to it. The fashion has been to try and increase the number of oral presenters. One of the ways of doing that is to shorten the actual individual presentations down to about 5 minutes. This typically, again, means a 3-minute presentation from yourselves and a couple of minutes to answer questions from the floor. The title slide should contain all the authors who have contributed to the study itself, together with the hospital or institution you're writing from. In the USA, it's important to then have a conflict of interest, a declaration of conflict of interest slide. In the BAPS or European meetings, this is less important. From then on, you should have some kind of logical sequence of slides. You've been used to constructing your abstracts in a logical sequence, and it's a reasonable idea to follow that kind of sequence as well for the oral presentation. Try and connect each and every slide so it flows naturally. Try and avoid sharp changes in thought processes. And if you can, end on and leave a message. And then wait for the inevitable applause. So in conclusion, deliver what you've got to say with confidence. You, after all, are the expert on what you're talking about. Avoid complex slides like this. So often you hear, I'm afraid this is a busy slide, but if you know it's a busy slide, don't put it up. And again, I reiterate, try and make some kind of logical progression. It's a thought process. Leave them with the message and leave them on time. You don't want the chair trying to catch your attention saying you've gone on far too long. Please come to the end of your presentation. It doesn't sound right. And then await the inevitable questions. But again, remember, you're the expert. Thank you very much for this.